Question 1. A patient is prescribed amoxicillin 250 mg capsules 3 times daily for 10 days. How many capsules should be dispensed? A. 10 capsules. B. 20 capsules. C. 30 capsules. D. 60 capsules. Answer: C. 30 capsules. This question tests your ability to calculate the total quantity needed for a prescription based on the dosage and duration. The patient takes the medication 3 times daily for 10 days, so you multiply the daily doses by the number of days. Calculating $3 doses per day times $10 days equals a total of $30 doses. Therefore, $30 capsules are needed for the full treatment course. A practical example is counting out the pills for a prescription to ensure the patient has enough. Always multiply the number of doses per day by the number of treatment days to find the total quantity. Question 2. Which of the following drug classes is commonly used to treat high blood pressure? A. Antibiotics. B. Antidepressants. C. Beta blockers. D. Statins. Answer: C. Beta blockers. This question asks about drug classes used for a specific condition, high blood pressure, which is a key topic in the top 200 drugs. Beta blockers, like metoprolol or atenolol, work by blocking the effects of epinephrine, slowing the heart rate and reducing blood pressure. Antibiotics treat bacterial infections, antidepressants treat mood disorders, and statins lower cholesterol. Understanding drug classes and their primary uses is essential for recognizing common medications. Remember that drugs ending in olol are often beta blockers used for blood pressure or heart conditions. Question 3. According to federal law, how long must prescription records be kept by a pharmacy? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer: B. 2 years. This question tests your knowledge of federal record-keeping requirements for pharmacies. Federal law, specifically the DEA regulations for controlled substances and general pharmacy practice standards, requires that prescription records be maintained for a minimum of 2 years from the date of filling. State laws may require longer periods, but the federal minimum is 2 years. Keeping accurate and accessible records is crucial for audits, refills, and patient care continuity. Always know the federal minimum requirements, and be aware that state laws might require even longer retention periods. Question 4. What is the primary function of the P&T committee in a hospital setting? A. To manage pharmacy inventory. B. To decide which medications are included in the hospital formulary. C. To process insurance claims. D. To counsel patients on medication use. Answer: B. To decide which medications are included in the hospital formulary. This question relates to pharmacy operations and quality assurance within an institutional setting. The P&T Committee, which stands for Pharmacy and Therapeutics Committee, is a group of healthcare professionals responsible for evaluating and selecting medications for the hospital's approved drug list, known as the formulary. This ensures safe, effective, and cost-conscious medication use within the facility. While pharmacists manage inventory and may counsel, and technicians process claims, the formulary decision-making is the primary role of the P&T Committee. Think of the P&T Committee as the gatekeepers deciding which medications the hospital pharmacy can keep in stock and dispense. Question 5. A medication label reads, "Store at controlled room temperature." What temperature range does this typically correspond to? A. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. B. -20 degrees Celsius to -10 degrees Celsius, -4 degrees Fahrenheit to 14 degrees Fahrenheit. C. 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. D. Above 30 degrees Celsius, 86 degrees Fahrenheit. Answer: C. 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. This question assesses your understanding of proper drug storage conditions, a critical aspect of quality assurance and medication integrity. Controlled room temperature is a standard pharmaceutical storage instruction defined by regulatory bodies. It typically means a temperature maintained between 20 degrees Celsius and 25 degrees Celsius, with excursions permitted between 15 degrees Celsius and 30 degrees Celsius under certain conditions. Proper storage ensures the medication remains stable and effective. Remember that refrigerated storage is typically 2 degrees Celsius to 8 degrees Celsius, not room temperature. Question 6. Which auxiliary label should always be applied to a prescription for metronidazole, flagyl? A. May cause drowsiness. B. Take with food. C. Avoid alcohol. D. Shake well before use. Answer: C. Avoid alcohol. This question tests your knowledge of specific drug interactions and the importance of appropriate auxiliary labels for patient safety, relevant to the top 200 drugs and patient counseling. Metronidazole is known to cause a severe disulfiram-like reaction when combined with alcohol, characterized by nausea, vomiting, flushing, and headache. Therefore, a prominent "avoid alcohol" label is crucial. While some antibiotics might cause drowsiness or stomach upset, the interaction with alcohol is particularly significant for metronidazole. Always check for critical drug interactions and apply the necessary warning labels. Question 7. A prescription requires mixing 500 milliliters of a solution. You have a concentrated stock solution and need to dilute it. This is an example of what type of pharmacy activity? A. Inventory management. B. Sterile compounding. C. Non-sterile compounding. D. Medication therapy management. Answer: C. Non-sterile compounding. This question asks you to identify a common pharmacy activity based on the description. Mixing ingredients to create a medication product that is not required to be sterile, such as an oral solution or a topical cream, is categorized as non-sterile compounding. Sterile compounding involves preparing products free from microorganisms, like force solutions or eye drops, which requires aseptic technique. Inventory management deals with stocking medications, and medication therapy management involves optimizing drug therapy for patients. Preparing a mixture like an oral solution falls under non-sterile compounding. Question 8. The abbreviation QID on a prescription means: A. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer: D. 4 times daily. This question tests your understanding of common prescription abbreviations, which is fundamental to interpreting prescriptions accurately. QID is a Latin abbreviation standing for quater in die. It translates directly to 4 times a day. Understanding these abbreviations is critical for correctly preparing and labeling prescriptions. Always remember the common frequency abbreviations: QD, daily, BID, twice daily, TID, 3 times daily, and QID, 4 times daily. Question 9. A patient is prescribed warfarin, Coumadin. What common test is used to monitor the effectiveness and safety of this medication? A. CBC, complete blood count. B. BMP, basic metabolic panel. C. PT/INR, prothrombin time/international normalized ratio. D. LFTs, liver function tests. Answer: C. PT/INR, prothrombin time/international normalized ratio. This question is about monitoring specific medications, focusing on warfarin, a common anticoagulant in the top 200 drugs. Warfarin works by affecting blood clotting factors, and its effect is measured by the PT/INR test. This test determines how quickly a patient's blood clots, ensuring the warfarin dose is within a safe and effective range to prevent clots without causing excessive bleeding. While the other tests are important for general health, PT/INR is specific to monitoring warfarin therapy. Knowing which lab tests monitor specific high-alert medications like warfarin is vital for patient safety. Question 10. Which federal act established the 5 schedules for classifying controlled substances based on their potential for abuse and medical use? A. Food, Drug, and Cosmetic Act, FDCA. B. Poison Prevention Packaging Act, PPPA. C. Controlled Substances Act, CSA. D. Health Insurance Portability and Accountability Act, HIPAA. Answer: C. Controlled Substances Act, CSA. This question tests your knowledge of key federal pharmacy laws. The Controlled Substances Act of 1970 is the landmark legislation that created the scheduling system, Schedules I through V, for drugs with the potential for abuse or dependence. This act regulates the manufacture, importation, possession, use, and distribution of controlled substances. The other acts listed cover different areas. FDCA regulates food and drugs generally, PPPA requires child-resistant packaging, and HIPAA protects patient privacy. Understanding the CSA is crucial for handling controlled medications legally and safely. Question 11. A prescription calls for 100 milliliters of a suspension, and the directions are take 5 milliliters by mouth twice daily. How many days will this prescription last? A. 5 days. B. 10 days. C. 20 days. D. 25 days. Answer: B. 10 days. This math question requires you to calculate the duration of a prescription given the total volume and daily dosage. The patient takes 5 milliliters per dose, twice daily, for a total daily dose of $5 ml times 2 is equal to 10 ml dollar per day. To find the number of days the 100 milliliters will last, divide the total volume by the daily dose. $100 ml /10 ml day equals 10 days dollar. Calculating the day's supply accurately is essential for billing and ensuring the patient has enough medication. Always calculate the total daily dose first, then divide the total quantity by the daily dose. Question 12. What does the acronym DAW mean on a prescription? A. Dispense as written. B. Dispense all week. C. Do not substitute. D. Drug allergy warning. Answer: A. Dispense as written. This question asks about a common prescription abbreviation used to indicate prescriber preference. DAW is an abbreviation that means the prescriber requires the brand name drug to be dispensed, even if a generic equivalent is available. Different numerical DAW codes exist, e.g., DAW 0, DAW 1, with specific meanings, but the core concept is the prescriber's instruction regarding generic substitution. Do not substitute is another phrase with the same meaning as DAW. Understanding DAW codes is important for accurate dispensing and billing. Question 13. Which of the following medications is a common anticoagulant often prescribed to prevent blood clots? A. Omeprazole, Prilosec. B. Atorvastatin, Lipitor. C. Lisinopril, Prinival/Zestril. D. Rivaroxaban, Xarelto. Answer: D. Rivaroxaban, Xarelto. This question tests your knowledge of common medications and their uses, specifically identifying an anticoagulant from a list of top 200 drugs. Rivaroxaban, Xarelto, is a factor XA inhibitor, a type of anticoagulant used to prevent or treat blood clots. Omeprazole is a proton pump inhibitor for acid reflux, atorvastatin is a statin for high cholesterol, and lisinopril is an ACE inhibitor for high blood pressure. Recognizing drug names and their classes is a fundamental skill for a pharmacy technician. Many anticoagulant drug names have endings like aban or aran, like Warfarin. Question 14. What is the purpose of a National Drug Code, NDC, number? A. To identify the patient. B. To identify the prescriber. C. To identify the drug product, manufacturer, and package size. D. To identify the pharmacy. Answer: C. To identify the drug product, manufacturer, and package size. This question asks about the purpose of the NDC, a key identifier in the U.S. pharmaceutical system. The NDC is a unique 10 or 11-digit number found on prescription and over-the-counter drug packaging. It is divided into 3 segments. The first identifies the manufacturer, the second identifies the specific drug product, strength, dosage form, and formulation, and the third identifies the package size. This number is crucial for billing, inventory, and identifying specific drug products. The NDC is like a unique barcode for every medication package. Question 15. A prescription is written for lisinopril 10 mg number 30 tablets, Sig, 1 tablet per daily. What does PA mean? A. By injection. B. By mouth. C. In the eye. D. As needed. Answer: B. By mouth. This question tests your knowledge of common prescription routes of administration abbreviations. PA is a Latin abbreviation standing for per os, which translates to by mouth or orally. This indicates that the medication should be swallowed. Knowing these abbreviations is essential for correctly interpreting prescription instructions. Other common routes include for, intravenous, IM, intramuscular, top, topical, and OU, in each eye. Question 16. If a medication recall is issued for a specific lot number of a drug, what is the pharmacy's primary responsibility? A. To contact all patients who received the drug. B. To immediately remove the affected product from stock and quarantine it. C. To notify the prescribing physician. D. To dispense the remaining stock before discarding. Answer: B. To immediately remove the affected product from stock and quarantine it. This question relates to quality assurance and patient safety procedures in a pharmacy setting, specifically handling drug recalls. When a recall is announced, the most immediate and critical step is to prevent dispensing the affected product. This is done by physically removing the recalled lot number from active stock and placing it in a designated quarantine area separate from other medications. Patient notification may follow, and physicians may be notified, but securing the product is the first priority. Never continue to dispense a recalled product, safety comes first. Question 17. Convert 2.5 liters to milliliters. A. 25 milliliters. B. 250 milliliters. C. 2,500 milliliters. D. 0.0025 milliliters. Answer: C. 2,500 milliliters. This is a basic conversion question commonly found on pharmacy math tests. The conversion factor between liters, L, and milliliters, ml, is $1 \text, L, equals 1,000 \text, ml, $. To convert liters to milliliters, you multiply the number of liters by 1,000. Therefore, $2.50 \text, L, times 1,000 \text, ml/L equals 2500 text ml $. Unit conversions are fundamental in pharmacy calculations. Remember that milli- means 1,000th, so there are 1,000 milliliters in 1 liter. Question 18. What does the abbreviation NPO mean in a hospital setting? A. New prescription order. B. No patient observed. C. Nothing by mouth. D. Narcotics prescribed only. Answer: C. Nothing by mouth. This question tests your knowledge of common medical abbreviations used in various healthcare settings, particularly hospitals. NPO is a Latin abbreviation standing for nil per os, meaning nothing by mouth. This instruction is used when a patient should not ingest anything orally, often before surgery or certain medical procedures. Understanding this abbreviation is vital for administering medications correctly in a hospital. If a patient is NPO, they cannot take oral medications. Question 19. Which government agency is responsible for enforcing the Controlled Substances Act? A. Food and Drug Administration, FDA. B. Centers for Disease Control and Prevention, CDC. C. Drug Enforcement Administration, DEA. D. Federal Trade Commission, FTC. Answer: C. Drug Enforcement Administration, DEA. This question asks about the primary federal agency responsible for regulating controlled substances. The Drug Enforcement Administration, DEA, is the lead federal law enforcement agency responsible for combating drug trafficking and distribution in the United States and enforcing the Controlled Substances Act. While the FDA regulates food and drugs overall, the DEA specifically handles controlled substances. Knowing the roles of key federal agencies in pharmacy regulation is important. The DEA is the agency that registers pharmacies and healthcare providers who handle controlled substances. Question 20. A unit dose system in a hospital pharmacy involves: A. Dispensing a 30-day supply of medication to each patient. B. Dispensing medications in individual, ready-to-administer doses. C. Storing all medications on the patient care unit. D. Using automated dispensing cabinets for all medications. Answer: B. Dispensing medications in individual, ready-to-administer doses. This question describes a common method of dispensing medications in institutional settings. A unit dose system involves packaging medications in single doses, often labeled with the drug name, strength, and expiration date, ready for administration to the patient at the scheduled time. This system helps reduce medication errors and waste. While automated dispensing cabinets might be used with unit dose medications, the core concept is the individual packaging of each dose. The goal of unit dose is to provide the nurse with exactly what is needed for one dose at one time. Question 2-1. What is the generic name for the brand name drug Zoloft? A. Fluoxetine. B. Sertraline. C. Paroxetine. D. Citalopram. Answer: B. Sertraline. This question tests your knowledge of brand name and generic name equivalents for common psychiatric medications from the top 200 drugs. Zoloft is a well-known brand name for the antidepressant medication sertraline. The other options are also antidepressants but are generic names for different brand name drugs. Fluoxetine is Prozac, paroxetine is Paxil, and citalopram is Celexa. Knowing common brand generic pairs is essential for identifying medications. Many generic antidepressants end in INE or pram. Question 22. How many ounces are in 1 pint? A. 8 ounces. B. 16 ounces. C. 32 ounces. D. 64 ounces. Answer: B. 16 ounces. This question tests your knowledge of standard apothecaries or household measurement conversions, relevant for pharmacy calculations. There are 16 fluid ounces in 1 pint. This conversion is often needed when dealing with liquid medications or volumes expressed in household units. Knowing common volume conversions like ounces to pints, pints to quarts, and quarts to gallons is helpful in a pharmacy setting. Remember, 2 cups is 1 pint, and a cup is usually 8 ounces, so $2 times 8 equals $16 ounces in a pint. Question 23. Which of the following is a common side effect of opioid pain medications? A. Diarrhea. B. Constipation. C. Increased heart rate. D. Low blood sugar. Answer: B. Constipation. This question asks about common side effects of a major drug class, opioids, which are frequently encountered in practice. Opioid pain medications are well known for causing constipation because they slow down the digestive system's movement. Other common side effects include nausea, dizziness, and respiratory depression, but diarrhea is typically not associated with opioids. Recognizing common side effects helps in patient counseling and identifying potential drug-related problems. Constipation is almost always a concern with opioid use, and patients often need advice on managing it. Question 24. What information is typically found in the SIG section of a prescription? A. Patient's name and address. B. Prescriber's signature and DEA number. C. Directions for the patient on how to take the medication. D. Medication name and strength. Answer: C. Directions for the patient on how to take the medication. This question is about understanding the components of a prescription, specifically the SIG or signatura. The SIG provides instructions to the patient on how and when to take the medication, including dose, frequency, and route of administration, e.g., take 1 tablet by mouth daily. The patient's information is in the patient demographic section, prescriber details are elsewhere on the prescription, and medication details are in the inscription section. The SIG tells the patient exactly what to do with the medicine. Question 25. If a pharmacy technician is stocking medications and places a new shipment of a drug with a later expiration date in front of the existing stock, what inventory management principle is being violated? A. Just-in-time, JIT. B. ABC analysis. C. FIFO, first in, first out. D. Par level system. Answer: C. FIFO, first in, first out. This question relates to proper inventory management practices in a pharmacy, focusing on avoiding waste due to expired medications. FIFO stands for first in, first out, an inventory method where the oldest stock, with the earliest expiration date, is used or dispensed before newer stock. Placing newer stock in front of older stock violates this principle, increasing the likelihood that the older medication will expire before it can be used. Proper stocking practices like FIFO are essential for minimizing loss and ensuring product quality. Always rotate stock so that the soonest to expire medications are at the front.